We take them to feel better, manage conditions, fight off infections, and most of the time, we don't even think about it. But have you ever really stopped to wonder what's actually happening inside your body after you swallow a pill?
I mean, it seems so simple, doesn't it? You pop a small tablet, and a little while later, poof, your headache's gone. But between that moment and the relief is this incredible, really complex journey. And today, we're going to follow along.
Think of a single drug molecule as the hero of our story. It's about to go on an epic, 4-stage adventure. First, it has to get absorbed into the system. Then, it gets distributed to where it needs to go. Next up is metabolism, where it gets a total makeover. And finally, elimination, when it's time to leave. So let's dive right into stage 1.
All right, stage 1, absorption. Look, before a drug can do any good at all, it has to get from the outside world into your bloodstream. That's the first and biggest hurdle.
Now, there are a few different ways to get in. The most common one, the one we all know, is just swallowing it. That's the oral route. It's the safest and most convenient. But drugs can also get in under the tongue or between your cheek and gum, or, of course, they can get an express pass with an injection. For our hero's journey, we're sticking with the classic, right down the hatch.
So how does our little molecule actually get from your stomach into your blood? Well, for the most part, it's through a process called passive diffusion. The best way to picture it is to think of a super crowded room emptying out into a big, empty hallway. People just naturally spread out, right? That's exactly what the drug does, moving from the crowded party in your gut into the wide-open highway of your bloodstream. No ticket needed.
But hold on, here's our first plot twist. Just because you take a 100 milligram pill, that does not mean 100 milligrams of the drug actually get into your circulation to do the job. A whole bunch of it can get lost along the way.
For a typical pill you swallow, maybe only this much actually makes it into the bloodstream. So what do we call that? This super important idea is called bioavailability. Put simply, it's the percentage of the drug that actually makes it to the starting line. So in our example, if 70 milligrams out of 100 get absorbed, the bioavailability is 70%. And understanding this is absolutely key for figuring out the right dose of any medication.
Okay, our drug molecule made it. It's in the blood. So now it's time for stage 2, distribution. It's about to hop on the superhighway of your circulatory system to get where it needs to go.
The bloodstream is amazing. It'll take our little molecule all over the body. But, and this is a big but, your body has some serious security checkpoints. Not every place is open to just any visitor. And this is where we see just how incredible your body's security systems are. In a place like the liver, the capillaries are what you'd call leaky. They've got big gaps so drugs can pass through pretty easily. But the brain? The brain is like a fortress. Its capillaries are welded together with these tight junctions, forming the famous blood-brain barrier. It's designed to stop most things from getting in.
So who gets the all-access pass to the brain's VIP lounge? Only very specific types of molecules. We're talking about lipid-soluble drugs, fat-soluble ones, that can basically dissolve their way right through the cell walls. But any drugs that are ionized or polar? Nope, access denied. And you can see why this is so critical for any medicine that needs to work on the central nervous system.
Okay, let's move on to stage 3, metabolism. After cruising through the body, our drug hero is about to face its biggest challenge yet, the liver.
See, your body is really smart. It recognizes that most drugs are foreign substances, and it wants them out of there. The liver is the main organ in charge of this cleanup job, breaking them down in a process we call metabolism. And the liver has this really clever 2-step process. In phase 1, it gives the drug a complete chemical makeover, changing its structure. Then, in phase 2, it attaches a special tag to it. Think of it like a kick-me-out sign that makes the drug water-soluble. And that is the whole point of this exercise.
So the ultimate goal here is to take a drug that's fat-soluble, which might otherwise just hang around in your tissues forever, and turn it into a water-soluble compound. Why? Well, because your kidneys are basically a big water filtration plant. If something's water-soluble, the kidneys can easily grab it and flush it right out of your body. Okay, so let's hit pause for a sec. Our drug has been absorbed, distributed, and it's being metabolized. But before we get to the final exit, let's answer the most important question of all. While it's zipping around your body, how does a drug actually work? How does it produce an effect? The easiest way to get this is with the classic lock and key analogy. Think of a drug molecule as a really unique key, and all over your cells you have these tiny, specific locks called receptors.
Our drug key is designed to fit perfectly into one of those locks, and when it does, it tells the cell to do something. Now, if a drug is an agonist, it's a key that doesn't just fit the lock, it actually turns it. It activates the receptor and kicks off a biological response, like sending a signal for pain relief to start. Then you've got an antagonist, which is the total opposite. This is a key that fits the lock perfectly, but it's designed not to turn. It just sits there, physically blocking any other keys from getting in and activating that lock. So the difference is simple, but it's incredibly powerful. An agonist turns a process on. An antagonist blocks that same process from turning on. And this fundamental difference is the basis for how pretty much thousands of different medications actually work.
All right, so now we know how our little drug molecule flips all the right switches. Let's get back to its journey. It's done its job, it's been processed by the liver, and now it's time to leave the building. This brings us to our final stage, elimination.
A really key concept for elimination is a drug's half-life. It sounds technical, but it's really just the time it takes your body to get rid of half of the drug. And this little number is what determines how often you need to take a pill. A short half-life means you might take one every 4 hours, but a really long half-life might mean just once a day is enough.
And that leaves us with a pretty fascinating final thought. We've seen this whole journey depends on absorption, distribution, metabolism, and elimination. But all of these things can vary a lot from person to person because of our genetics, our age, our health. So the really big question for the future of medicine is this: how do we get away from a one-size-fits-all approach and start creating treatments that are as unique as each one of us?